Hello friends, this video is about assisted vaginal delivery or an instrumental delivery. So assisted vaginal delivery, when I tell, it can mean either using a forceps or a vacuum. Now many who have undergone an instrumental delivery might have an idea about what it is. But to all those who do not know or who are nearing term and who have a lot of questions about what is this forceps or what is this vacuum or a cup that they use to deliver your baby, let me tell you few doubts which patients repeatedly ask me. So number one, when the mother is not able to push for longer than 2 hours or she is really exhausted pushing her baby out. And the second reason when we put an instrument is when the baby's heart rate is becoming a little bit abnormal. Now these two conditions, these are the two main conditions when they have to or the obstetrician decides to expedite or speed up the delivery using an instrument. Now you can ask me, doctor, why don't we go ahead and do a cesarean section? See, the baby is really down in the birth canal. It just needs some help, or the mother only needs some help so that it can come out easily. Now instead of taking her to the theatre and opening her up, and when the baby is lower down in the birth canal, to remove it by cesarean section is also not very easy and it has its own set of complications. So that is when we use an instrument called forceps. Another forceps are something like two spoons will be, it has long tongs or it is a spoon like device. So it is a metal structure. Now it will be put into your birthing canal and with the help of maternal effort, the baby will be pulled out. The another one that we use is vacuum. Vacuum is generally, now we do not use metal cup, we use soft cups. Now that will go and get attached to the back of your baby's head and the baby will be just pulled out with the help of mother's efforts. And both these instruments require maternal efforts. Now which instrument has to be put, it will be depending on the situation and also the gynecologist or an obstetrician's decision. Now before we go ahead with this delivery, it will be informed to the mother and a consent will obviously be taken. Now after the delivery, many women ask me, doctor, what if you put the forceps and my baby has mark on the head? Definitely it can have, there is every chance of baby having marks and there are other complications also associated with it. Now those marks, let me reassure you friends, it will go away on its own and you need not fear about it. And once we put a vacuum cup, that is when we put it on the back of the baby's head to pull it out, there can be a blood collection in that area. Now that swelling will also subside in about 48 to 72 hours. Now because of that swelling, the baby can develop mild jaundice. Now because of these two, this complications of mark and this jaundice, you need not say complete no to an instrumental delivery. There are other risks also associated with instrumental delivery, but these two are frequent risks which we see in babies, which women are really worried about. So you have any more doubts about instrumental delivery, kindly let us know. I would be more than happy to answer your doubts. Thank you so much. Take care.